What if one simple change, taking one vitamin right before bed, could bring firmer erections, deeper sleep, and more energy after 60? Sound too good to be true? Stick with this video until the end and you'll get a clear, step-by-step plan. Which vitamin to take, why timing matters, how much to use, the easy bedtime habits that amplify results, and a realistic 30-day timeline so you know what to expect. If this matters to you, hit like, subscribe, and drop a short comment saying I'm in, or share one sleep or energy struggle you've had. It helps others and keeps you in the loop for more simple fixes. Most people take vitamin D in the morning with breakfast and move on. That's comfortable and familiar, but it misses an important point. Repair and hormone production happen during sleep. Taking vitamin D3 before bed lines it up with your body's natural nighttime repair systems, the time when melatonin, testosterone, and other recovery processes ramp up. When the timing is right, the vitamin supports those processes rather than sitting unused. Here's why the timing idea makes sense in plain terms. At night, your body shifts from active mode to repair and restore mode. Melatonin rises, inflammation tends to fall, and tissues get a chance to rebuild. Vitamin D3 is more than a bone nutrient. It acts like a helper hormone that affects immune cells, blood vessels, and hormone pathways. Giving the body steady access to D3 during the sleep window can help those nightly repair signals work better together. That doesn't mean a single pill will fix everything overnight. Results take steady use and the right dose for your body. Start with a modest dose and keep it consistent. Many people pair D3 with vitamin K2 so calcium is directed correctly in the body. Also take D3 with a little fat for better absorption. A spoonful of nut butter, a few nuts, or a slice of avocado work fine. Simple sleep habits amplify the effect. Dim lights before bed, stop screens at least 30 minutes prior, and aim for a routine bedtime. Finally, check your levels with a blood test and talk with your clinician if you're on medicines or have health conditions. That way you're giving your body support in a smart, safe way that fits into real life. Most people take vitamin D in the morning with breakfast and move on. That's comfortable and familiar, but it misses an important point. Repair and hormone production happen during sleep. Taking vitamin D3 before bed lines it up with your body's natural nighttime repair systems, the time when melatonin, testosterone, and other recovery processes ramp up. When the timing is right, the vitamin supports those processes rather than sitting unused. There's a biological reason this makes sense. Vitamin D receptors sit in many tissues, including the brain and hormone-producing glands, so the nutrient can influence overnight repair, inflammation control, and hormone signaling when those systems are most active. Evening dosing also gives the body a steady supply through the overnight hours when immune cells and tissue repair pathways are doing heavy lifting. That doesn't mean everyone will notice dramatic changes right away. People respond differently based on baseline levels, age, body fat, and health conditions. But lining supplementation up with sleep is a simple, low-effort tweak that often improves consistency and absorption. Make it practical. Take vitamin D3 with a little healthy fat at night. A spoonful of nut butter, a few nuts, or avocado to help your body absorb it. Consider pairing with vitamin K2 so calcium is directed to bones, not arteries. Start conservatively. Many men over 60 use 2,000 IU nightly, and check a 25 OD blood level after 8-12 weeks to adjust safely. If you have kidney disease, a history of hypercalcemia, or take certain medications, talk to your healthcare provider first. Taken thoughtfully and consistently, nighttime D3 can be a small change that supports the body's natural repair cycle and helps other healthy sleep habits work better. Track sleep, mood, energy, and sexual function weekly and note changes. Stick to consistent nightly D3 with a little fat. Maintain regular bedtimes, daytime sunlight, and light exercise. Discuss blood tests and drug interactions with your doctor to tailor safe dosing. Recheck levels every 8-12 weeks. Now, by the end of week 1, Tom noticed he slept more soundly and didn't wake up as often. By week 2, his mornings felt clearer and he had more energy through the afternoon. Around week 3, he called to say something he hadn't said in a long time. He'd had a strong morning erection. It wasn't a miracle. It was the body responding when given support at the right time and with steady habits. Along the way, he paired the supplement with a few simple changes that made a big difference. He stopped screens 30 minutes before bed, kept a consistent bedtime, and took his D3 with a small spoon of peanut butter so the fat helped absorption. He also picked a product that included vitamin K2 that helps direct calcium where it belongs, and stored a log so he could track sleep, energy, and libido day to day. That quiet tracking helped him see patterns and stay motivated. Tom didn't guess about safety. His doctor rechecked a 25 hydroxyvitamin D level after 8 weeks and looked at basic metabolic labs to make sure calcium stayed normal. That's an important step if you plan to supplement long-term or take higher doses. For most people, a conservative nightly dose is well tolerated, but individual needs vary and blood work tells the real story. The practical takeaway from Tom's experiment is simple. Small, consistent actions stack over weeks. Nightly D3 timed with sleep, paired with basic sleep hygiene and a little dietary fat, can support the repair and hormonal rhythms that tend to weaken with age. Results vary, but when you combine a sensible dose, sensible timing, and sensible monitoring, the payoff is often better sleep, steadier energy, and improved intimacy, the same pattern Tom experienced. If you're considering this, run it by your healthcare provider so you start safely and track progress. Start modestly, recheck levels after 8-12 weeks, and adjust with your clinician. Remember that supplements support healthy habits. They're not magic fixes. Keeping notes, staying consistent, and consulting your doctor help you find the right dose safely and sustain gains over months. In week 1, Tom noticed he slept more soundly and didn't wake up as often. By week 2, his mornings felt clearer and he had more energy through the afternoon. Around week 3, he called to say something he hadn't said in a long time. He'd had a strong morning erection. It wasn't a miracle. It was the body responding when given support at the right time and with steady habits. Over the next few weeks, Tom kept the routine and added a couple of simple practices that helped the progress stick. He stopped screens an hour before bed, kept lights dim in the evening, and made sure to take his D3 with a bite of healthy fat so it absorbed better. He also walked 20-30 minutes most days and did a few gentle strength moves twice a week, both things that improve circulation and hormone balance. Small lifestyle tweaks like these often multiply the benefit of a single supplement. If you try this, be realistic and safe. Many men see gradual improvements over 3-8 weeks, but responses vary. It's sensible to check a blood 25-0 level before starting or after 8-12 weeks to confirm you're in a healthy range. Most experts aim for roughly 30-50 ng/ml, though targets can differ. Don't exceed very high doses without medical supervision. If you're on blood thinners, have kidney disease, or take other medications, talk with your clinician first, especially because adding vitamin K2 or raising vitamin D can interact with some treatments. Watch for signs of too much vitamin D or calcium, persistent nausea, excessive thirst, muscle weakness, or confusion, and stop the supplement and seek care if they appear. When used thoughtfully and monitored, this simple bedtime strategy can be a safe, effective piece of a broader plan to improve sleep, energy, and sexual health. Start slowly, keep a short daily diary of sleep, mood, and erections to notice trends, and prioritize consistent bedtime habits. Recheck levels and symptoms with your clinician. Adjust dose only under medical guidance, and remember real benefits build gradually with patience and steady routines. Check progress at 8-12 weeks. Why are so many men deficient? There are a few common reasons. Less time outside, living farther from the sun, changes in skin absorption as we age, or good intentions to avoid sun exposure for skin protection. The result is the same, a quiet, gradual decline in vitamin D3 that many confuse with normal aging. Even when men take D3, taking it at the wrong time or taking the wrong form can blunt results. Other hidden reasons add up. Carrying extra body fat can trap vitamin D and make it less available in the bloodstream. Certain medications, some anticonvulsants, steroids, weight loss drugs, speed vitamin D breakdown. Gut problems, celiac disease, Crohn's, or past bariatric surgery cut absorption. And if the liver or kidneys aren't working at full speed, the body can't convert vitamin D into its active form as efficiently. Seasonal swings and living at high latitudes mean long winters with almost no skin production for months. Testing is the straightforward fix. A simple 25-hydroxyvitamin D blood test shows where you stand. Many clinicians aim for a level that feels good for the individual, commonly around 30-60 ng/ml. But that range can be tailored based on health conditions. If you start supplements, recheck after 8-12 weeks to confirm you're in a safe, effective zone. Supplement choices matter. D3, cholecalciferol, is better absorbed and used than D2. Combining D3 with vitamin K2 helps direct calcium into bone instead of soft tissues, and magnesium is a helpful cofactor for vitamin D metabolism. Take the supplement with a little fat to boost absorption. A spoonful of nut butter or some avocado is enough. Be sensible with dose and safety. Most healthy adults stay within 2,000 IU daily unless directed otherwise. Higher doses should be monitored by a healthcare professional. Watch for rare signs of too much vitamin D, nausea, excessive thirst, weakness, and discuss interactions with any prescription drugs you take. Choosing a reputable, third-party tested brand also reduces the risk of poor quality products. Here's a practical 30-day timeline to keep expectations realistic. Night 1, the body starts using the nutrient to support melatonin and sleep. Night 7, many report waking more refreshed and carrying better energy through the day. Night 14, mood and libido often begin to lift. Mild morning erections can reappear. Night 21, circulation and stamina feel improved. By day 30, a meaningful shift for many: better sleep, steadier energy, and more reliable sexual function. Individual results vary, but this is the pattern others have shared. If you try this, make the 30 days a simple experiment and track 3-4 things so you know what's changing. Sleep quality, how often you wake, how rested you feel, daytime energy, mood, libido, and any morning erections. A short daily note or a simple app makes differences clear. Before you start, consider getting a baseline 25-hydroxyvitamin D blood test so you know where you began. Common targets are roughly 30-50 ng/ml, and deficiency is often under 20 ng/ml. Many men use 2,000 IU nightly with vitamin K2 and a little dietary fat for absorption. But don't exceed recommended upper limits without a doctor's okay. Chronic very high doses can raise calcium levels and cause problems. Check in with your healthcare provider if you take medications, especially blood thinners like warfarin, have kidney disease, or have a history of hypercalcemia or kidney stones. If you notice troubling symptoms, nausea, excessive thirst, muscle weakness, or persistent stomach pain, stop and seek medical advice. For most people, the safest approach is modest, consistent dosing, improved sleep habits, no screens 30+ minutes before bed, and a retest of vitamin D after 8-12 weeks to fine-tune the dose. Small, steady steps plus measurement are the best way to know whether this nightly habit is helping you. Keep a simple checklist and review results at 30 days. If you see benefit, continue and recheck levels every 8-12 weeks until stable. Consistency, modest dosing, and improved sleep habits are the best path to safe, lasting gains. Be patient, gains will come. Add a simple, repeatable wind-down routine. Dim overhead lights and switch to a soft lamp or candle 45-60 minutes before bed so your brain gets a clear signal that night is coming. If you must use devices, enable a blue light filter or wear blue-blocking glasses to reduce melatonin suppression. A warm shower or bath can help too. It raises core temperature briefly, and the cooling afterward helps your body settle into sleep. Make the bedroom a sleep tool. Keep it cool, roughly 60-67 degrees F/15-19 degrees C, quiet and dark. Blackout curtains or an eye mask reduce stray light. Earplugs or a white noise machine can block disruptive sounds. Reserve the bed for sleep and intimate time only. Avoid working, worrying, or watching TV there so your brain associates the bed with rest. Use simple relaxation habits right before lights out. 2 to 3 minutes of slow breathing, a short guided meditation, or progressive muscle relaxation can help lower heart rate and make it easier to fall asleep. If your mind races, keep a small notepad by the bed and jot down the 1 or 2 things you'll tackle tomorrow. This clears the mental clutter. Watch what you eat and drink in the hours before bed. Avoid heavy meals, spicy foods, and alcohol late at night. They can fragment sleep. Limit caffeine to the early afternoon. A light snack with healthy fat, a few nuts or a spoonful of nut butter, can improve vitamin D absorption if you're taking it at night and prevent hunger wakings. Finally, support the nighttime routine with daytime habits. Get 10-20 minutes of morning sunlight, Move your body earlier in the day, a short walk or resistance work, and keep a steady wake time even on weekends. These small, consistent choices amplify the effect of the vitamin. And if you have chronic health conditions or take medications, check with your healthcare provider before making changes. Try it for 30 days, note sleep, energy, and libido in a simple log, and get a blood test after 8-12 weeks to check 25 OD. Adjust dose with your clinician if needed. Gradual changes are safer and more reliable. Monitor. A few practical tips to keep it safe and effective. Get a baseline blood test for 25-hydroxyvitamin D, 25 OD before you start, so you know where you begin. Many doctors aim for a level between about 30-50 ng/ml, though some prefer 40-60 ng/ml for symptom improvement. Your clinician can advise a target that fits your health. Recheck levels after 8-12 weeks on your chosen dose to see whether you need to adjust. Watch for signs of too much vitamin D, nausea, weakness, frequent urination, or bone pain, and contact your provider if these occur. True toxicity is rare but can raise blood calcium, hypercalcemia, so avoid taking very high doses long-term without supervision. If you take calcium supplements, coordinate timing and doses with your provider. D3 plus K2 is meant to help calcium go into bone, but too much calcium, especially with certain health conditions, can be harmful. Magnesium supports vitamin D metabolism and sleep quality too, so a modest magnesium supplement or magnesium-rich foods, nuts, leafy greens can be helpful. Be cautious if you use medications such as thiazide diuretics, some anticonvulsants, or certain heart drugs. These can interact with vitamin D or change calcium balance. Finally, couple supplementation with the bedtime habits mentioned earlier. Dim lights before bed, keep a regular sleep schedule, and include gentle daytime activity and some safe sun exposure when possible. Consistency matters more than a one-off big dose. If you stay consistent and monitor with simple blood work and symptom checks, you'll give the strategy the best chance to support sleep, energy, and sexual function as you age. Also consider checking kidney function and parathyroid status with your clinician, since chronic kidney disease or hyperparathyroidism change vitamin D targets and monitoring needs. Limit heavy alcohol use and avoid concurrent high-dose vitamin A or calcium-rich antacids. Keep a simple daily log of dose, sleep, energy, and erections to spot trends. Work with a pharmacist or endocrinologist if unsure, and pause supplementation and seek care if new symptoms appear. Thanks for watching. I appreciate you spending the time. Stay tuned for more information and practical tips related to improving sleep, energy, and sexual health. We'll be sharing more step-by-step guides and evidence-informed strategies in upcoming videos.